Can you see the screen now?
Yes.
Yeah, let me know now first from all of you. Do you have any queries or anything related to the topics? Yes, I cannot hear from you anything. My voice is clear.
Yes, doctor.
Yes, it's clear.
Yes, doctor.
So you people don't have any queries?
No, no.
Sorry?
No, we
Nothing?
don't.
You don't have any?
Yes, but we would like to have a quick revision if you.
Doctor.
Hello? Sorry?
Yes, doctor. In the lecture 10, you mentioned something about the feed forward mechanism.
Yes.
Can you explain it again, please?
Yeah, can you? I will ask the question first to you before explaining. Relation to what I told you, feed forward mechanism. For what? Tell me first.
It was for the GIP.
Yeah. Yes, tell me.
It stimulates release of insulin. You said it's the feed forward.
What stimulates
it's the opposite of
release of insulin?
GIP.
Yeah, and GIP is, what is the stimulus for GIP?
A meal, I think, yes. The
What
presence of meal.
specifically in the meal? Any meal?
No, I think glucose. It was especially
Good.
glucose.
So when glucose is just before getting the absorption in small intestine, the glucose will stimulate the release of GIP. Okay. And then
Okay.
GIP will stimulate the release of insulin. What is the function of insulin?
Okay.
What is the main? Don't go to a detailed one related to glucose only.
Yeah. To decrease glucose in blood.
In blood, yeah. It means the glucose uptake in the tissues. So it will help the glucose uptake in the tissues. So the level of the glucose in the blood will decrease. Okay, isn't it?
Yeah.
And that is what this whole thing is, homeostasis. Am I right?
Mm-hmm.
Homeostasis is maintenance of the internal environment. Like to maintain the glucose level is one of the homeostatic mechanism. Do you agree with this?
Yes.
Do you agree or not? Yes. So now we have two types of homeostatic mechanism in your body. One is feedback. Another one is feed forward. What is the feedback mechanism? In the feedback mechanism, the corrective mechanisms or corrective measures will take place in your body after the change has taken place. So, for example, if I say temperature regulation, okay. So during the temperature regulations, what happens like when the body temperature rises? So there are some homeostatic mechanisms in your body which will help to decrease the temperature.
Yeah.
Like vasodilatation in the skin and so many other things.
Or sweating, yeah.
Sweating, yeah. So this means that change has taken place. What is the change? The rise of temperature. And the correction will come after that. This is known as feedback. Feedback. But now if you see here, the example which I have given for GIP, here the glucose has not yet absorbed in the blood. And the glucose level has not increases in the blood, it means that change has not taken place. Are you getting my point?
Yes. Yeah.
Change is yet to take place. Change is going to take place after some time. But before that, the GIP has stimulated the insulin and insulin is ready now to catch the glucose. So corrective
Okay.
measure has been taken place before the change has taken place. And this is known as feed forward. You got my point?
Yes. Yes, thank you.
My pleasure. Yes, anyone else?
Doctor,
Doctor,
Sorry,
there is no revision, just questions.
this is not a revision. I'm not going to take the revision. If you don't have question, I will explain this chart. That's why I open this chart. So first I am giving you chance to ask the questions to make some clear, any clarifications.
Okay, so can you explain this chart,
Sorry?
please? We don't have any question.
Yeah, then I'll proceed with the chart. Good. So no one is having any questions? No. I never take the tutorial by opening the slides and talking about talking the same thing what I told you in the lecture. That is not my idea of taking the tutorials, and I never really reveal you the important slides also from my lecture. That is not a revision actually. That is giving up that is limiting your knowledge to the exam, and I don't believe in that. So now let's. But I will tell you how to prepare for the exam. That is my purpose. Have you seen this chart before? Have you seen this table
Yes,
before?
lecture two.
one of
No.
the
Sorry?
and also one of the lecture with Doctor.
Last lecture, good. But this lecture is from where? The slide is from where? Did I told you about it? Yeah, but the slide is from where?
Maybe
Apart from my slide, have you seen this picture anywhere?
Yes,
the book.
the lectures with the other doctor for the physiology.
They have taken this one.
Yes, I
Yeah,
think.
leave it. I'm telling leave all PPTs. I don't want to talk about the PPTs. Forget about the lecture, PPTs and all.
Okay.
Have you seen anywhere else? Anyone?
No,
From
no.
a book,
Yes. Which book?
the textbook physiology one, I think.
What is the name of the textbook?
By Guiten, this one, the 11th edition, I think.
Sorry.
The Guiten and Hall 11th edition, I think.
Gajan and Hall. What is another textbook? Okay, I'll say this is not from Gajan and Hall. What? Tell me the name of another textbook. You know this name of the textbook, but you're right. This is from textbook, but not from Gajan and Hall.
Human physiology.
human physiology.
Everything is human physiology, all textbook. Laura Lee Sherwood, wonderful. It means that no one has opened the textbook yet in the GIT. Isn't it? Am I right? No one has opened the textbook for physiology. Am I right? Exactly. Yeah. This now remember I call it. Yeah. So this is but this is a very important chart from that same book. Usually I bring this chart to you in the first lecture, but I have not taken the first lecture of GIT. Dr. Mujib has taken the first lecture. And again, I bring this chart in the last lecture. And if you read this chart, no need of opening the books of physiology at all. If you understand all the lectures from first lecture to the last lecture, if you understood the concept, and now before the exam, if you read this chart, reading means doesn't mean just you are just reading the words secretion, digestion, absorption. No, not this one. Another way of reading it, making it much bigger chart out of this chart. You have to write down on this chart at every aspect. What is this chart contains? I don't know. Can you see the cursor here on the screen or not? Cursor is moving on your screen also. Yeah. Okay. Not good. So now you see here first on the first column here, all the digestive organs are listed, which we have taken in the lectures, like mouth, salivary gland, esophagus, stomach, pancreas, liver, small intestine, and the large one. The first column is of second column is of motility, then secretion, digestion, and absorption. So these are the 4 functions, main functions of GIT, isn't it? And all our lectures are based on this. All our lectures are based on motility, secretion, digestion, and absorption. So what we have to do now, we have to start at each level, like from the mouth, and then selecting each organ. All these 4 things we will be discussing. So how to discuss that thing? Let's take an example from here, from starting from the mouth. Now, I want you to now, when I ask the question, don't look into the chart and these things. Reply to me from your memory, okay? What you understood from your slides before in the lecture, because this is a preparation for exam. Whether you give the answer correctly, that is not important. You should be able to answer in the exam correctly, that is more important. So just now my questions, take it seriously, listen and give me answer from your knowledge. So what type of motility in the mouth? Okay. What type of motility in the mouth?
Chewing.
Chewing is the name. Okay. What type of motility? I'm telling type.
Voluntary.
I'm not
There's
telling you the name. I'm not telling you to name the
mechanical.
motility.
There's mechanical.
When you say a motility, there are 2 types of motility in our body, voluntary and involuntary. Okay.
Voluntary.
Chewing
It's
is
voluntary.
voluntary. Okay. So which muscles?
Skeletal.
Skeletal, perfect. Wherever you say a voluntary, it should be from skeletal muscles.
Yeah.
Isn't it?
Yeah.
Okay. Now coming to the secretion, second part of it, and we know the function of chewing now. Actually, I have. We can go in detail now. What is the function of chewing? What you are achieving from it? Sorry. Food is the function of chewing.
Motility.
No, breaking down the food into smaller surface area.
Okay. Breaking down the food into smaller chunks, as well as one more function it will do, chewing. Think. Breaking it down and
combine mixing it with the
okay,
saliva.
mixing it with the saliva. Perfect. So that it will be now lubricated and it will help in digestion also, and it will help in swallowing. This a lubricated material will be thrown back to your throat easily. Okay, coming to secretion. Second function of the mouth here. So when I tells about secretion in the mouth, it comes from salivary gland. Okay. So now how many salivary glands we have?
3.
3, sure.
No, more.
No,
3
more
more,
than
good.
3.
Then 3. Main are 3. Agreed. Main are 3, isn't it?
Yes.
Okay. So now what are 3? Can you name it?
Parotid,
Lingual, submandibular, parotid.
submandibular.
Okay. Parotid, submandibular, sublingual. What is the main one? Which one is the main? Main means the major bulk of saliva comes from where?
Parotid.
Parotid.
Oh, no. Submandibular.
I can hear 2. Parotid
Sub-
and submandibular. So what you vote for? 2
Parotid.
answers I'm getting.
Submandibular.
Submandibular.
Sure. Yes. Submandibular is the main gland which contributes to 70% of the saliva. Now, this is the bulk we are talking about. But what are the types of this salivary gland? Are they classified depending upon the type of saliva they secrete? Or they are same?
No, there's types.
How?
And mucus or
Mucus, serous?
yeah.
Only 2?
Or mix.
Mix, perfect. So now you classify for me. The parotid. What is the parotid? Serous.
Yes.
What about submandibular? Mixed. What about sublingual? It's mainly mucus, not mix. So mix one is, just remember, don't say mainly and wo. Just remember simple. Parotid is serous, sublingual mucus, and yeah, some mandibular is mixed. Is that fine?
Sublingual mix, doctor.
Sublingual is mucus.
Okay.
Is there or no need of noting down? This is there in your slides. I'm telling you how to read this table. So whatever I'm discussing now, you have to go in a, when you will read before the exam, you have to note down beside everything. You see, these things are not written in the table, but when we are recollecting our knowledge back, you have to write down everything. And now I will come to the content of saliva. Next thing, whenever we talk about secretion, you know, we discuss about the content. And two main contents will remain common everywhere. What are those?
Mucus.
Electrolytes.
And
Mucus.
Water and
Not mucus.
electrolyte.
Water and electrolytes. I told you so many times in my lecture, it will remain everywhere. Water and electrolytes. Other than that, now you have to see what is special in the saliva. What is special in the saliva other than that?
Lysozyme.
Okay. And
Amylase.
amylase.
Salivary.
Good.
Yeah,
Sorry?
salivary.
Saliva, definitely salivary amylase, because we are talking about saliva. So salivary amylase, lysozyme, mucus. We have IgA, antibody secreted over here, isn't it? Am I right?
Yes.
Yes. How much saliva is secreted in 24 hours?
1.5 liters.
1.5 what? Liters per
Day.
day, per 24 hours. Yeah. So now we have seen how much saliva, we have seen what is the composition. Now from this composition, if you remember the composition easily, you can see what is the function. Because when you think of composition, now say the function of each components, automatically the function of saliva will come out. What was the first composition I talked about? Water. So what will be the function? Now think of the water in the saliva. What may be the functions? Come on. Lubrication. Okay, good. Sorry. Okay, help in chewing. Good. And think of more functions of water in your mouth.
Easy to swallow.
Easy to swallow. And
Yeah. And
And-
break the food.
you're repeating same and same. More. Come to more. Chewing, somebody said chewing, it means breaking. Swallowing, it means lubrication. Come to other thing. What are the functions water is doing in your mouth? What is the main function of the water? Everywhere.
To mix with the
Everywhere. What is the main function of water everywhere other than the mouth?
hydrate.
Exactly. Hydrate as well as clean.
Yeah.
Isn't it a rinsing of your mouth when you eat something that is in between the teeth and in the gingiva, everywhere the food particles are stuck. So when the saliva comes, it rinses your mouth completely. So it hydrates also and it cleans also. So it will prevent it from the mouth infections as well as dental caries, the gum infections, all they are prevented from. So it has got protective function. Apart from it, okay. Apart from the protective function, does the water also helps in something? Is water is helping me in the mouth now? Speech, isn't it? If my mouth will become dry, will I able to speak? No. So, okay. So now we have finished the function of Sorry, water. What comes next? What is the next content?
electrolyte,
Yes. Which electrolyte saliva is rich in? Yeah. And bicarbonate. Good. So can you think of function now?
Neutralize.
Neutralize the acid in your food, isn't it? This is one of the function of saliva. Comes to the next component here, amylase.
digestion,
The addition of what?
carbohydrate,
Carbohydrate. Does it completes in the mouth?
no,
No.
No.
Then it attacks
Begin.
polysaccharides to disaccharides. Sorry. So it begins in the mouth. This word I want. Carbohydrate digestion begins in the mouth with the help of salivary amylase. Function of the mucus.
Lubrication.
Good. Protection.
Neutralizes if it's alkaline mucus.
Yeah. Lysozyme.
For bacterial.
Bacteria.
Bactericidal. Good. Again, protection. IgA.
Protection also.
Again, the defense. Again, the protection. Immunity. See, you see now, from each of the component, we have derived the function of saliva now. One more function of water we forget. If you think carefully, how water is helping in the mouth. I'll give you a clue. This water is helping something on your tongue. What is there on your tongue?
Dilute something. What?
What is there in your tongue? On your tongue?
Taste bud. Taste buds.
Taste buds. Absolutely right. And remember that the taste buds cannot perceive any taste sensation unless the taste molecule they are dissolved first. Taste sensation is a chemical sensation, remember, whether it's a sweet, whether it's sour, whether it's salty. All these are chemicals. And these taste particles need to be dissolved in water first, then only it will be perceived by the taste buds. A simple example of it, if you go outside in the Riyadh, tell your friend to open the mouth and take out the tongue, hold the tongue of your friend with your fingers. Within 2 minutes, not even 2 minutes, 30 seconds, the tongue in the Riyadh weather, the tongue will become dry, isn't it? Now tell her to close the eyes and put some sugar crystals on the tongue. They will not able to identify what you are putting on the tongue. Now just if you add few drops of water, suddenly they will say it's sugar. Why? Because the water has dissolved that sugar particles and then perceived by the taste buds. Okay, now this is the function of the saliva we have discussed. Did you forget something in the mouth, another motility other than the chewing?
swallow,
Mixing the movement
With
of
the
the
help of
tongue in mixing.
mobility of tongue, yes, we forgot the motility of the tongue. Is your tongue voluntary?
Oh, it's involuntary.
It is involuntary
With the mixing.
for whatever.
No, it's
not.
voluntary, skeletal.
Sure, it's voluntary.
Yes.
Which muscles? Which muscles in the tongue?
Skeletal.
Skeletal muscles in the tongue, so it's voluntary.
Yes.
So according to book, your tongue is voluntary. But I am giving some other
Doctor,
statement.
didn't we say that once we start swallowing, we can't stop?
Yes, totally right. But I am talking about tongue now. I'm not talking about swallowing.
Oh. Okay.
Okay. Tongue is not the only organ for swallowing. Am I right?
Yes.
yes,
Yes. An initial part of the swallowing is voluntary because you uses your tongue. Isn't it? Yeah. So now, but let me complete the sentence. I don't agree with your book. Your book is telling that tongue is voluntary. So I want to write a new sentence over there in your book. I think it is supposed to be voluntary. Mafrood, voluntary, isn't it?
Mm-hmm.
How? Think from the morning till now. Does your tongue was under your control? What is the function of the tongue? One of the function of the tongue is speaking.
Speaking.
Talking, yeah, speaking.
And does your tongue is under your control? If
Sometimes.
somebody got
No.
if somebody got the control over the tongue, they will win the world. That's my words. Isn't it?
Sometimes.
Impossible to control it, isn't it? Oh, she has
Yeah.
done that. He has done that. You see, this Dr. Sharik, we started the tutorial since half an hour. He has not revealed a single question what is important coming to our exam. Isn't it? This tongue is very dangerous organ here. Involuntary. Leave it. Come to the digestion in the mouth. We have function the secretion in the mouth. Come to the digestion in the mouth. Is there anything digested in your mouth?
No.
Carbohydrate.
Carbohydrate digestion begins. Just now
But
you
it
said
starts
amylase.
there.
Amylase, isn't it? Digestion
Yes.
going on. Digestive process going on in the mouth. Carbohydrate digestion begins. Is there anything absorbed in the mouth? Nutrients, any nutrients absorbed?
No.
Mainly no.
But
But somehow some important medications are absorbed.
yes. But no nutrients, no food, no.
No main nutrients because the complete digestion nutrient doesn't finishes in the mouth itself. So the drugs example, simple example is nitroglycerin as it is written here. There's some other also there. It's absorbed in the mouth. So see now how I have went through, how we have completed the mouth. It's all not written here. Are you getting my point? Like secretion, how much we have elaborated. We have written here content. So you have to write down your content here. Then you have to write down the functions over here. One more thing is remaining here. When you're talking about secretion, that make a circle and let's go beside here, write the control of the secretion. How the control of the salivary secretion occurs. Come on, who will tell me? In one sentence, I want the control of salivary secretion in
Neural
two
only.
words, two words, two
Neural.
words. Neural. One more
Yeah.
word. You are half correct, so add one more word to it. Absolutely right. Perfect. Only neural. Good. And this will help you in remembering now. Keep this thing only neural in your mind. Salivary secretion is only controlled neurally. Which nerves? Which nerves? Come on. Which nerves? Good. So sympathetic is stimulatory, parasympathetic is inhibitory.
No.
Am I right? Both are stimulatory. Absolutely right. This is the only place in your body where some of the places are in the body where only both sympathetic and parasympathetic they are having same action, and one of it is saliva. Good. So in this way, now you have to go on for every level. I will skip the swallowing here. I will not go to swallowing because in esophagus. Okay, in short, we will cover esophagus. Any motility here in the esophagus?
No, it's a direct
No
descent.
motility in the esophagus? Which type? Which type?
Just
Which type? That is a name. That is the name of motility you're telling, peristaltic. Absolutely right. What type of motility? Voluntary, involuntary?
involuntary.
Involuntary. Absolutely. Now coming to the secretion. Any secretion in the esophagus?
Yes,
Mucus.
only mucus for lubrication and for
Yeah.
easier.
Any digestive enzymes
Passage.
secreted here in esophagus? Any digestive enzymes?
No, there's no time to digest or absorb anything.
But any secreted? Any? I'm not asking the time or not. Is there any digestive enzyme secreted? No.
No.
No,
Digestion? Any digestion takes place?
No.
no.
Think carefully before telling no.
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 Your esophagus doesn't contribute in digestion. Totally agreed. But is there any digestive process taking place in the esophagus? Think again.
Yes.
What?
No.
Are you getting my words? Your esophagus doesn't contribute in digestion, but is there any digestive process continues in esophagus? Now you'll get it.
Okay.
Carb,
Okay.
carbohydrates.
Doesn't it continues in the esophagus?
Yeah, until it reaches the stomach and stopped
Absolutely
by
right.
the HCl.
Absolutely right. Absolutely right. So you're right. You're not wrong. Your esophagus is not contributing to the digestion, none. But carbohydrate digestion continues. Okay, fine. Agrees? You agree or not?
Yeah, doctor.
Good. Comes to the stomach. Same thing. What type of motility in the stomach? Yes?
Peristaltic.
Peristaltic?
Involuntary, sorry.
Okay, involuntary. Now, can you tell me what what are different types of? Okay, what have you seen that it has got? We have divided into the 4 functions of the stomach: storage, mixing. First is reception, isn't it? Remember reception. Reception of the food, storage, mixing, and what?
Secretion of HCl.
Now I'm talking about motility. Reception, store, mix, and what is the last?
Empty.
Emptying. Absolutely right for these. These all are involuntary. So I'll not go in detail because I'm not going to revise everything. There is a receptive part is known as receptive relaxation. It has got mainly 2 things. While receiving the food, it relaxes, receiving and storing the food. But when it wants to move it on, it contracts. That is a peristalsis. And receptive relaxation, this is carried out by, controlled by what? Receptive relaxation is controlled by a hormone or a nerve or what?
Vagus.
Nerve. Vagus nerve.
Vagus. Absolutely right. That's why if the patient, in some of the patients, we are doing vagotomy. You know why vagotomy is done? Have you heard of vagotomy? What is vagotomy?
No.
What is vagotomy? From the word
Related
Removal of the vagus
Tommy.
nerve.
Yeah, cutting of vagus that supplies to the stomach. If you cut the vagus, why you will cut the vagus to the stomach? Think what vagus is doing in the stomach. What is stimulating in the stomach? What vagus stimulates in the stomach?
A receptive relaxation. So for
Sorry.
more food to enter.
Secretion. Which secretion? Mainly. Guessing okay, but one thing, something important. HCl. Those patients who has developed severe ulcers, gastric ulcers, but they are not controlled by any medications. Patient is bleeding, so that sometimes we have to go for vagotomy. Okay. Now you think patient has undergone the vagotomy. Which aspect of the motility will be affected?
A receptive relaxation.
Absolutely right. This is how you have to study the GIT in applied aspect. You see, knowledge of secretion, we have applied to the motility. Something we are using in the control of the secretion management, what side effect that management has got. Are you getting? And believe me, all the questions in the exam, will be applied. None of the question will be asked to you directly. Even in the end block, be ready for that. Some questions are coming from MBOS also. Be ready. Coming to secretions, what is secreted in the stomach?
HCl.
Which cells?
HCl.
Which cell?
Parietal.
Parietal cell. Then
Mucus.
okay, which cells?
Mucus cells.
Okay. Next. Why are you thinking so much? Gastric secretion, come on fast. So many things inside.
Gastrin.
Gastrin. From where?
Yeah. G cells.
G cells. Is gastrin exocrine or endocrine? G cell endocrine or exocrine?
Endocrine.
Endocrine. Sorry, again you should
Endo.
the answer. What is this? Endo or exo?
Endocrine. Endo. I think
Right.
endo.
Come on, give me the evidence. Both of you give me support your answer with evidence. Come on, who tell endo? Come on, who tells endo?
Endo.
Yes,
Endo.
can you? Who said this endo? Please name. Who said this endo?
Renin.
Ranin, come on, give the supporting evidence why you're telling endo.
Because it goes to the blood.
It goes to blood. Any evidence you have to say that? Who else? Yes. What is that reflex? What is that reflex? What is that reflex?
Gastrocolic.
Absolutely right. It is a hormone. We have studied gastrin is a hormone. Gastroileal reflex, gastrocolic reflex. It is involved in the motility of whole of the GIT, not only motility of the stomach, isn't it?
Yes.
Yes.
And also
Come on,
gastroileal
gastrin,
reflex.
HCl, finish. What next? Pepsin, exocrine, endocrine, paracrine. Pepsinogen, but it's not pepsin, first of all, remember.
Exocrine.
Sure.
Yes, exocrine.
Why? Local or what word do you want to use?
Paracrine.
It goes to
Paracrine.
where? Stomach is the whole stomach. Where it goes? Released
No,
where? In the lumen. It released in the lumen.
And
That's why it's exocrine. Absolutely right. Anything else? Secreted in the stomach?
intrinsic factors.
Okay. Anything else? One more thing. More thing.
Wait. Histamine.
My weight is 75 kg. You're asking my weight? Sorry? You asked my weight? No, weight. I said 75 kg. Now tell me the answer. What? You don't need my weight. You need my height. Perfect weight. Now tell me what is else is secreted in the stomach.
Somatostatin.
Sorry?
Somatostatin.
I cannot hear.
Somatostatin.
Okay, somatostatin, good. Something else? One more thing. No, at all. Not at all. Not at all. Something in the stomach. E cells. E cells. Come on, E cells.
E cells.
Yeah. Enterochromaffin-like cells.
Histamine.
Absolutely right. Histamine.
We said histamine before.
You didn't say it.
I said it before.
No, I didn't heard. You just asked my weight. I said you are my weight. That's all.
Okay.
Okay. Now, so now these are the content. I'll not go in detail of the functions. You know the function of each. How much is the gastric secretion?
1.5.
1.5. Control. How the gastric secretion is controlled. Now you say in the saliva we have said two words, isn't it? Only biological. Can you put?
Neural.
Do you want to put some word here, which will describe the control of the gastric secretion? 2 or 3 words. That's all. Or one word even. Good. Both. It's hormonal as well as neural control.
Neural.
Is there any phases of gastric secretion control? Phase. Is there any phase? Is there any phase of control? Is it control in phases?
No.
No. Altogether? Is it not like that the gastric secretion is controlled before the food arrives to stomach? Then when the food is
yes.
in the stomach,
Yes.
then food has left the
Yes,
stomach.
it's in phases. Yes.
Sorry, what are the name of the phases?
Cephalic.
Before gastric.
Cephalic.
Cephalic. In cephalic phase, mainly the control is
Neural.
neural.
Vagal. With the
Okay. In gastric phase, what is the main control in the
Mechanical.
gastric phase? Both
Hormonal.
hormonal and the neural.
and neural.
What about the
Fine.
intestinal phase?
Hormonal.
Only? Is it hormonal only?
Mm.
Both.
No, hormonal only?
We have enterogastrons. Enterogastrons released from the. What are
Ah,
enterogastrons? Can you name the enterogastrons?
Trypsin.
Cholecystokinin and secretin from small intestine. They act on the stomach to slow down the motility of the stomach. This is, and also we have neurological, which is known as enterogastric reflex. Remember, through the intrinsic
yes.
nerves, which continues from the small intestine to the stomach. So we have both control, isn't it?
Yeah.
Oh yes. So remember about this gastrin. Gastrin also, the question on the gastrin will never be asked to you directly. Hormones, questions on these hormones will never be asked. A question on the function of the SCL, question on the function of the histamine will never be asked to you directly. This will be applied aspects. Indirectly, questions will be asked to you. So now when you know these functions, when you know the function of gastrin, isn't it you know the function of gastrin? Many functions you know. Gastrin mainly controls the motility throughout the GIT, isn't it?
Yes.
It stimulates the release of HCl. Am I right or not?
Yes.
Yes.
So now nobody will ask you what is the function of the gastrin in the exam. A case scenario will be such that you have to understand this question is related to gastrin, this function is related to gastrin. So which hormone might be increased or decreased? Which function is affected, what it increase, what is decreasing? So in that aspect, you have to think about the answers. Now coming to the digestion, any digestion takes place in the stomach? First. Come on.
Yes.
What digestion takes place in the stomach?
Protein begin
Digestion begins or ends or continues what?
formation of carb.
Starts with the help of
and carb.
with the help of
Yes.
pepsinogen and
Gastrin.
helped by HCl. Gastrin is not released in the stomach. Gastrin is released in the blood. So it cannot help in digestion. Are you getting my point? Gastrin
Yes.
cannot help in digestion. It's because it's not released in the lumen. Anything absorbed in the stomach?
No.
Nothing absorbed?
Liver.
Alcohol and aspirin. There are two A. Two A's are absorbed in the stomach, alcohol and aspirin. Okay, now it's the same way you have to go for, continue for the pancreas also. Same way the discussion will go for the liver. Let's come down to the part which, because pancreas is taught by Dr. Mujib, I'll come back to little lower part, liver taught by me. Any motility in the liver?
No.
Liver doesn't move?
No.
Liver doesn't contract? Liver does not contract? Sure. You don't know how you don't know. You finish the GIT. You should know. Does anyone know the liver contracts or not?
I think no.
Yes, so it secretes
Yes.
the bile.
Liver contracts? Which muscles?
No, there's no contraction in the
No
liver.
contraction, but it
There is-
needs movement to move the bile, right?
Liver moves. Sometimes it moves from the right hypochondrium.
No,
to
not the liver.
No,
not,
no.
not the liver.
Sometimes the liver comes to your mouth. So while chewing the food,
Not
you
the
can chew
liver.
your liver together. No need of purchasing the kebda sandwich from outside. You can chew your own liver. It will move, come to the mouth. Am I right? Yes? Angry on doctor now? You don't want to reply me? Liver has got no muscles, no motility. Forget about it. Secretions. How much bile?
1.5.
500 ml. What does the bile content? Mainly. Okay. So bile salts, main function, I will not go for all. Can you tell me the main function of bile salts?
Emulsification of
Sorry?
emulsification of lipids.
Sorry, the voice was shaking a little. Can you repeat? Emulsification. What is the emulsification? That process related to which nutrient? Which nutrient you're talking about?
Lipid.
Fats. So it helps in digestion of
Lipid.
Fat.
fats. So whenever the bile secretion will be affected, digestion of what will be affected?
Of fat.
Fat. Can you think now one condition where the bile secretion might be affected? What is the possibility of bile secretion affected?
Gallstone, there's stones.
Okay, the simplest one, obstruction. Okay, isn't it? Obstruction to the bile secretion that comes from the gallstones. So what will the problem if patient is having gallstones?
No bile salts, so
Jaundice.
So
of fat.
undigested fats will be there, isn't it?
Yes.
So
And there will be obstruction,
I'm
right?
giving a clue, how you should remember. Nobody will ask you the function of the bile salts. A question will not directly come to you so easily. What is the function of bile salts? Fat digestion. No. This is for primary school. This question is in the schools. All this high school student knows what is the function of liver. The question will be asked to you given a scenario, case scenario, when something is shown to you that you have to understand from the scenario, okay, in this case, the bile secretion is affected. So what will happen finally? Indirectly, like this way, questions will be asked. Question will not be asked to directly on the gastrin. Nobody will ask you on the pepsin. Question is made how the patient will present to you. So always
Jaundice and steatorrhea.
you have to think of now whenever any case scenario is given to you, either it's related to stomach, whether it's related to pancreas, whether it's related to liver, read the case scenario clearly and think what function of that organ might have affected. Okay. And how you will think of the function of the organ? First, you have to think of the functions. And when you come to the liver, you will say, okay, it secretes bile, it secretes bilirubin and it secretes so and so. And now read in the case what signs and what symptoms they are showing. Then you have to come to the physiological function of it. Yes, anyone was asking me in between? Sorry, I didn't heard. Can you repeat? Somebody was asking something.
No, doctor.
Is that clear? Is that clear? My explanation is clear to you?
Yes.
Okay, good. Because from always in the beginning of my GIT, I am telling to you nowadays 25% of the questions in the exam will be from the books and from MBUS. And these questions will be applied clinical questions. And this change we have brought on the request of the student only. This is not the change to torture you or to make the exam difficult. This request came from the student. Your senior student who are now at the final level, they realize that our students are getting difficulty in passing the USMLE. They are getting difficulty in passing the Saudi licensing exams. Because in our exams, the questions are not asked in that way. So this is to help you in future becoming a good doctors. Okay, coming to small intestine, we'll finish in few minutes. Don't worry. Just I want to tell you a little idea about small intestine. Same way, we have to study in the same way. What type of motility? Come on.
Segmentation and MMC.
MMT. Two names are segmentation and the migrating
MMC.
motility complexes. Now, from this motility, if there is a meal, what type of motility will be there?
Segmentation.
In between the meal?
Migrating motility.
And shifting between these two motility, which hormone is responsible to shift between these two modalities? Wrong.
Motilin.
Wrong. Try all hormone now. One will come correct.
Doctor, was one responsible for
And don't
the
ask my weight again.
Motilin.
Motilin. Absolutely right.
Doctor, I said motilin. You told me wrong.
You said gastrin first.
No, motilin.
And
Okay.
your mic was Urban. My ears are very good. I'm still young.
Yeah. Always the problem in us.
My weight is perfect, 70 kg. My age is perfect. Everything is perfect for me.
Yes, doctor,
Agree?
you are perfect. Yeah.
You had to agree. On Sunday there is exam. You had to agree with everything. I know.
Yeah, we agree. We didn't say anything else.
Yes. Come to the secretions. Secretions comes from where? Come on, Mac, reply to my question. Secretion to small intestine comes from where?
Pancreas.
Okay, pancreas and
Succus entericus.
succus entericus comes from where? What no?
Brush border.
Succus entericus comes from where?
From the brush border.
No.
Small intestine.
Wonderful answer. Small intestine. Better you said not the human body. I was expecting human body. Good, you said small intestine. Succus entericus come from where?
From glands.
Come on. Who will make my day now? It is end of my working day. Who will make me happy?
Cells of
None of you can want to make me happy end of the day. Very bad people.
cells
Yes,
of Cajal.
none of you want to make me happy at the end of the day.
اليوم of
I have not seen such a bad people.
Project.
Sorry? Somebody was telling something. Please go on.
interstitial.
Cells of interstitial cells of Cajal.
Is this a local will secret?
From the small intestine.
It's glands
Fantastic.
in
From
the small
intestine.
intestine.
You realize me that I'm talking about small intestine. Good.
Doctor, طب why not microvilli?
Tell me from where? Give me the answer. It is in the
Lumen
slide.
of Frankenstein.
Lumen.
There in the
Exocrine
slide. I'm
gland.
asking the question from slide.
Exocrine glands.
Where exocrine glands are located.
In the lumen.
None of you has revised the slides also. Forget about books. I told you, none of you has decided to make me happy today. I accepted. Bad day. No problem. Bad day. Have you heard of crypts of lubricants?
Yeah.
Oh, yes.
Yes. I was knowing, but I could not answer in the exam. Doctor should give me mark. As soon as I came out of the exam hall, I remember crypts of lubricant was the answer. Isn't it? Isn't it?
Yes.
This happens in the exam also. Yes. Okay. So we have seen the secretion is coming to the small intestine from pancreas, from livers, from succus entericus that is secreted from the crypts of lubricants. Is that it? Am I right?
Yes, doctor.
Okay. So if now from so many places the secretions are interrupted in the small intestine. But if you think that patient is suffering from mainly his stool is light color with froth in the stool. What type of stool I'm talking about? Clay color stool. Clay color stool with
There's
some
the
froth. What type of stool I'm talking about?
you said
Can
white
anyone name?
stool.
Can anyone name? Rubin?
There's no urobilinogen. So
Sorry? Okay. So then secretion of what is affected?
Bile.
Okay. If undigested fat is coming in the stool and also
Sterco-
it's light color, what type of stool I'm talking
stercovilin.
about?
Bacteria.
Sorry?
No.
Bile salts.
Doctor, can you repeat the question again, please?
Undigested fat is coming in a stool.
Undigested fat. So steatorrhea.
Yes. So which secretion is affected?
Pancreatic lipase.
Bile.
Sorry?
Bile. Pancreatic lipase. Bile.
Yes. Bile. I guess somebody's telling bile.
Pancreatic lipase.
So
But
pancreatic
bile.
secretion is affected.
Yeah.
Yes, I am
Why?
giving a clue how to go for the things now. When it comes to small intestine, the secretion is not coming from one place. Are you getting my point? Something is coming from liver, something is coming from pancreas, something is coming from succus entericus. So depending upon the symptoms, now you have to think for which organ's function is affected.
Doctor,
Are you getting my point?
No.
No. How you don't know? Just now I said to you. You have to think of the symptoms. What symptoms are given in the case?
If there is
Whether it's a
steatorrhea,
symptoms related to undigested fat, your idea will go towards pancreas.
why?
When you say
Why not?
something that it's discolored stool, mainly it's you are going that and even going towards the obstruction in the liver, like gallstones.
Yes, you said pancreatic lipase, not bile salt, or both. You mean?
No. When bile salts will be there, not released, your fat will not come undigested so much in the stool. Does
Yeah,
the steatorrhea occurs when there is a gallstone?
yes,
Steatorrhea occurs when there is a gallstones?
yes.
No.
When steatorrhea occurs?
If there is obstruction,
When the steatorrhea occurs?
when there is obstruction, there is no fat.
What is the cause of
There's
steatorrhea?
deficiency.
Which organ is affected?
The liver,
Which organ is affected? It will lead to steatorrhea.
liver or pancreas.
Gallbladder.
Pancreas.
Pancreas. It's
Yeah.
pancreas.
So
When liver
gallbladder-
is affected, liver bile is only helping to digest the fat. It's not digesting the fat.
so
So
there's
when
no
the liver
steatorrhea.
is affected,
So mainly
there
the
is
fat-
jaundice.
The steatorrhea is the condition which is diagnostic of the pancreatic damage. So depending upon the condition, you have to think of which organ you have to think of. In the liver, mainly the problem will be discoloration because there is no bilirubin. Somebody just mentioned to me here. Isn't it? There is no stercobilin. And there will be some undigestion of the fats of frothy type of thing will be coming in the stool. But not completely undigested like steatorrhea that is happening in the pancreatic damage. So in this way, you have to think of what idea and clue I am giving here is related to every organ I am talking about its function, but I'm not thinking directly. You have to think of the case, how in my patients, what will be the affected and how I can go to the diagnosis. Isn't it? Are you getting the point or not?
Doctor, what about the bilirubin?
Sorry. Yeah, what about bilirubin?
It's not effect.
Sorry?
It's not defect in the steatorrhea.
In what?
In steatorrhea.
No.
Okay.
Steatorrhea is the main problem coming from because of what?
Pancreas.
Pancreas. Absolutely right. Let me just a second. I will come back to you. Just a second. I'm coming back. Give me a second just. Okay. So, sorry, I was just replying to a message. So, do you understand what I mean to say you, how you had to answer in the exams? Is that clear? Is that clear? Like some of the secretion of the small intestines, hormones. Now we are after large intestine, there is another, it's not mentioned here. I have taken the lecture hormones. List of hormones we have covered. Let's say secretin. Secretin is released from where?
S.
Sorry, S cells. Secretin is released from S cell. Am I right? All of you agree? All of you agree? Secretin is releasing from S cell.
Yes, doctor.
Okay. So now this, what is the function? Which from which organ? S cell in which organ? Small intestine.
intestine.
What is the stimulus for the release of the secretin?
HCl.
HCl, good acid, isn't it? Where it will act? Where they will act? Where secretin will act?
In the duodenum.
Sorry?
In the duodenum,
What
it
is the
will act on
action?
the
What is the
stomach.
action of secretine? Come on.
It will inhibit and
Inhibits what?
secretion.
Gastric emptying and go on more.
Secretion.
From where?
Inhibit
From
gastric
where?
secretion and
That is the secretion of the, it means the increase the secretion of the bicarbonate rich secretions from pancreas as well as liver, duct cells, isn't it? Is there any action on the stomach secretion?
yes, it inhibits it.
Sorry?
Inhibits the
Inhibits
stomach secretion.
all secretion, HCl secretion and hydrogen ion, that isn't it?
Yes.
So now if there is HCl will be affected, these all functions will be affected or not?
Yes, other functions will be affected.
Absolutely. So nobody will ask you a direct question. Whether the question will be either asked to you related to the S cells, what is its functions, if you stimulate it, or if it is damaged, what functions will be affected. Indirectly, you have to think of everything. But for replying to those questions, you have to know the functions of all those things. And this table will help you in revising everything. This table is a wonderful table that help you in revising everything. You see, I have covered from stomach, I have covered the mouth, I have covered the stomach, pancreas runningly, and small intestine now runningly. Similar to the large intestine, you have to come here. What type of motility in the large intestine? Sorry. What type of motility in the large intestine?
Involuntary.
And okay. The mass movement is what initiates the mass movement? Okay, what is that reflex? Gastrocolic reflex. Now, gastrocolic reflex initiate one more reflex. What is that? Now,
Gastroileal.
gastrocolic reflex initiate another reflex. Okay, good. Defecation reflex. Defecation reflex is regulated by which spinal level?
S2, 3, 4.
2, 3,
S2,
4.
3, 4. Am I right? So if say example, what happens will if we go to the level of spine which will for symmetry through SDS, what will